In our office, we have a three-pronged approach to treatment. Number one, and a hallmark of what we do, is education. We educate our patients about what the actual issue is. We teach them about pain. We educate patients about how they can help themselves and the role they play in their recovery. The second thing we do is manual therapy, which, as we discussed in previous posts, includes anywhere from stretching to massage, mobilization, and manipulation. And then third, but last but not least, is exercise. So a hallmark of what we do is educating patients, because it's been shown that if patients understand their pain and what's causing their pain, they actually will experience less pain. They're less fearful in general. They're more likely to move without fear and with less pain. And they actually stick to the rehabilitation program longer because they understand that while some things may feel painful, it's not necessarily harmful. So overall, understanding the condition and pain in general is highly beneficial on the outcome for the individual. With that being said, and what we know about current pain science, we will be putting together a 12-part series, anywhere from 5 to 10 minutes each part, about pain and the nervous system and how the nervous system and the brain coordinate together to generate pain, and how we could actually begin to manage pain, particularly painful chronic conditions, which by all intents and purposes is pretty difficult to treat a lot of times. And by adding the understanding and the education component, like I said before, the research has shown this to be highly beneficial in patient outcomes. So today we're going to begin with part one, which is understanding sensitive nerves and a sensitive nervous system. And it's just a basic introduction to how pain is generated. And it may be different than what a lot of people might expect the pain experience to be. A lot of times we associate, I step on something or I pull my back out, the back is generating pain. And what we know through research is that that's not necessarily the case. That information is transmitted to the spinal cord and then eventually up to the brain as danger signals that something has occurred in the periphery. And the brain ultimately makes a decision about what to do with that. In some instances, depending on the context and the circumstance, the brain may produce pain. In some instances, we have damage in the periphery, and for whatever reason, the brain decides not to produce pain because it's not in the best interest at that moment. A classic example is you're running across the street and all of a sudden you see a bus coming, you twist your ankle, but you make it across the street. An hour or so later, you realize, oh, I sprained my ankle. But at that moment, you didn't even realize that you twisted your ankle because the brain decided that it's more important for you to get out of the way of the car or the bus than it is to produce pain at that moment. Other times, you could be walking along and you just barely roll your ankle, you step on a little rock, and you have instant pain, and you know that immediately. So it's really interesting. There's a lot of facts to be discussed, and hopefully with each one of these series, you learn a little something that you may have not known before. Maybe you could share it with people because it's a very interesting topic. So like I said, we will be beginning with part one. It's the sensitive nervous system.